Diarrhea is a very common problem in young children and babies. It is often associated with fever and vomiting. When a child gets diarrhea and vomiting, she loses a lot of fluids from the body and it makes her dehydrated. Dehydration is a very dangerous problem in young babies and children. They feel very weak, they may develop a fever. And you will find that they has less in terms of tearing and they pass less urine in their diapers. Diarrhea can be caused by infections and sometimes by food intolerance. The most common cause of infection in children is the rotavirus. The rotavirus infects the stomach and the intestines and makes it unable to absorb the nutrition in the intestines. The rotavirus spreads very, very easily. It is actually found in the feces of the infected child. And it is spread by direct contact with the hands, with the diapers, or the toys of the child. It is very commonly spread amongst family members, in the hospital, and in daycare centers. A baby who is infected with the rotavirus often experiences diarrhea, fever, and vomiting. And the child will be less active, feeding less, tearing less, and probably will produce much less urine in the diapers. So if you think that your child has the rotavirus infection, contact the doctor, who should be able to do some simple tests to confirm the rotavirus infection. There is no medicines to treat the rotavirus. So if your child has the rotavirus infection, she needs to be fed with extra fluids, preferably with oral rehydration fluids. Sometimes the dehydration is so severe that the child requires to be admitted to hospital for intravenous fluids. Mothers who are breastfeeding the children should continue to do so. This ensures that the child gets enough fluids and nutrition. Good hygiene, namely hand washing and eating properly cooked food, helps to prevent against rotavirus infection. But the rotavirus is a very tough virus. Sometimes these measures are not sufficient, and that is why it is very important that parents immunize the children against the rotavirus. Most children who get the rotavirus vaccine do not get rotavirus diarrhea at all. The vaccine can be given with all of the other childhood vaccines. I think it is a vaccine that is worth considering by all parents. So if you have any concerns, any queries of the vaccine, kindly contact your doctor.